Okay, so we are looking at a thing which usually occurs, in some pregnant women. So it's like a traumatic disorder that usually comes as a result of what? Pregnancy and childbirth. So this is what is known as a post-traumatic stress disorder after childbirth. Alright? Post-traumatic stress disorder after childbirth. So it's also called postnatal what? PTSD or childbirth related PTSD. So it's a serious mental health condition. So it develops when birthing experience is perceived as traumatic. So it affects not only mothers but also what? Partners who have witnessed what? The crazy birth. Maybe your wife was in the birth room for a very long time, maybe even went in to witness the birth and all of that. So it was kind of like traumatic. So postnatal PTSD, as we'll call it from now, is triggered by real or perceived trauma during pregnancy. It could be during the labor, or postpartum period. That's after giving birth. So unlike postpartum depression, the PTSD centers around re-experiencing the trauma, trying to avoid it. Some women, they don't want to get pregnant again. So common symptoms is what? The woman is having flashbacks, nightmares of how she was giving birth. Avoidance of reminders. She doesn't want to go around that hospital again because it reminds her of the trauma she had there. She doesn't want to even see the baby again because the baby reminds her of the trauma she went through. Alright? So avoid hypervigilance, irritability, and exaggerated startle response. Alright? Emotional numbness, detachment or dissociation. Difficulties bonding with the baby because it's like the baby caused you a lot of pain and all of that. Guilt, shame, or anger after the birth experience. So causes and risk factors is if there was an emergency C-section, so the woman was feeling okay, there will be successful vaginal delivery. So later on now it was not successful. They had to now go into cesarean section. Severe pain or complications during labor, feeling powerless, unheard, or unsupported by the medical staffs. So medical staffs are now responsive. Right. So neonatal intensive care unit admissions or separation from your baby after the baby was delivered, previous trauma, okay, lack of social support or poor communication during the birth period. So how common is it? We said that around 4 to 6% of people who give birth usually develop it. About 15.7 may experience trauma-related symptoms. So partners can also develop it if they witness a birth that was really, really crazy. Alright, so treatment options: trauma focused treatment, eye movement desensitization and reprocessing, reduces emotional intensity of trauma. So medications may be used for anxiety or depression symptoms, supports group or birth debriefing services. This one they can now explain to you, possibles, things that could come up during childbirth and all of that. Okay. So that's just it for the post-traumatic stress disorder after childbirth.